Look at any major hospital today, and you will see an infrastructure operating at maximum capacity. The physical space to treat patients is entirely congested. The math driving this congestion is compounding daily. An aging global population is colliding directly with a steady, long-term rise in chronic diseases. The core vulnerability in modern medicine is that it relies on episodic, facility-centered care. The system waits for a person to get sick enough to require a building and a bed, rather than tracking their health proactively. This bar chart exposes the financial strain of that approach. The traditional medical device sector is posting a sluggish 5 to 6% growth rate, while the line representing overall healthcare costs continues to rise sharply. Payers and hospital networks are facing a mathematical limit. To stop costs from spiraling and to maintain the quality of care, the industry has to pull patient management out of the hospital entirely. That extraction is already happening. Market research data shows the digital health and remote patient monitoring sector, known as RPM, is rapidly escaping the traditional medtech slump. This area chart visualizes the sheer speed of that adoption. The RPM market is jumping from $26.8 billion in 2025 to an estimated $80.8 billion by 2031. That is a 20.2% compound annual growth rate. This $80 billion surge signals a systemic shift in strategy. Healthcare providers are actively moving patient management away from hospital wards and into the persistent digital monitoring of the patient's daily life. Right now, North America is the geographic engine of this transition, securing 42% of the global market share in 2025. That dominance is directly tied to policy. Government entities made at-home care profitable by adjusting reimbursement frameworks, specifically anchoring RPM to Medicare Part D and activating new CMS billing codes for remote clinical monitoring. With the funds unlocked, chronic disease management has become the primary commercial application. The bedrock of this sector is continuous glucose monitoring for diabetes, utilizing a small wearable sensor that links directly to a smartphone. Legacy medtech companies recognized the shift early. Abbott Laboratories currently commands a massive 15 to 16% aggregate share of the global market. Their Freestyle Libre franchise alone generated $4.17 billion in revenue in 2024. This bar chart projects the future volume for that single application. Continuous glucose monitoring starts out as a $5.9 billion segment in 2025 and nearly triples to $16.2 billion by 2031. Commercial adoption at this scale happens for one reason. It directly aligns with payer cost reduction goals. Keeping chronic patients consistently monitored at home keeps them out of the emergency room. While North America provides the current volume, the geographic frontier for the fastest future growth is India. Expanding middle-class demand, paired with aggressive government-backed digital health initiatives, is driving the Indian market forward at a staggering 28.1% growth rate. Because baseline medical penetration is lower, India is experiencing a leapfrog effect. They are bypassing the decades-long process of building legacy hospital infrastructure and deploying scalable digital networks from day one. Technologically, there is an equally fast-moving frontier: mental health monitoring. Institutional acceptance of digital therapeutics has created a market for scalable tools that monitor behavioral health between physical therapy sessions. That niche is currently expanding at a 27.6% rate. Scale lives in North American glucose monitoring, but players looking for breakout velocity are racing to establish early mover advantages in these micro-markets. Hardware is becoming a commodity. The real value is in the invisible data streams generated by the devices. To survive the next decade of this expansion, medical device leaders have to stop selling standalone pieces of hardware. This flowchart maps the ecosystem-centric model. A wearable sensor feeds continuous data into a cloud infrastructure. AI processes it, returning clinical insights to the physician. This demonstrably improves clinical outcomes, satisfying value-based care, and keeps patients stable at home, drastically reducing healthcare system costs. Healthcare is moving beyond the four walls of the clinic. By integrating advanced biosensors with AI-driven diagnostics, the industry is establishing a persistent data loop that prioritizes wellness over emergency intervention.